40% of our hand hygiene action were to use soap and water, and only 60% were to use alcohol-based hand rub. And then, of course, using these, we did monitor and feedback the performance, a very key, important strategy in the promotion. Then, of course, we observed infections. Infections went down. We reduced infections by 50% on average. Has demonstrated the cost effectiveness of the strategy 8 years down the road, using all the resources counting all the resources that we use for monitoring, for education, for feedback, and for interventions at our institution. Of course, because we decreased infections. Now where are we? 15 years later, using the so-called Geneva model of hand hygiene promotion, here is actually our increased use in alcohol-based hand rub. Okay? Nowadays, 99% of actions at the bedside by healthcare workers at our institution is the use of alcohol-based hand rub. We don't use soap and water anymore. At our pilot sites, I will fly over this very quickly. Compliance improved. Whatever, whoever, wherever, compliance improved. And here are examples of the first 6 months of the campaigns in those sites. In several of those sites, infections were monitored in parallel, and actually infections went down. Common for hand hygiene that we developed, and in order to really change the practice. And to me, that's the next step toward improvement in hand hygiene. System change, multimodal strategy was really the first step, and this is the next step. And there will be other steps. So the key point is really to understand that education should be effective. It is important at all levels, really at all levels. We need to educate patients, we need to educate the family, we need to educate the media and the public, we need to educate the CEO, and of course, we need to educate the real-life bedside workers who have to apply this 5 moment all the time.